Okay, good afternoon, everyone. I believe everyone is now in the conference. Thanks again for joining this daily briefing of the City of Philadelphia's response to COVID-19. And today, again, all speakers are joining the briefing virtually to adhere to social distancing guidelines. To those members of the press who have just been brought into the conference, please remember to use the raise your hand signal. I see some of you already have. If you want to be recognized when we get to the Q&A portion. But first, we will begin our briefing with some opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Thank you, and good afternoon, everyone. Dr. Farley will give his update shortly, but he has informed me today that we now reached a very sad milestone. More than 5,000 Philadelphians have been diagnosed with COVID-19. This comes only a few short weeks after our first confirmed case. It is evidence of the speed with which this virus can spread, and evidence of the difficulty in slowing that spread. I know that Dr. Farley has commented that the rate of growth of cases has slowed, but we are still in a period where the numbers are climbing. So let this milestone of 5,000 confirmed cases be a reminder that we are not by any means out of this woods, and that with all the precautions we've been taking, need to continue. These have been difficult times, but together, safely apart, we can keep each other healthy. Now, I want to give a big shout out to our Office of Emergency Management. Working in conjunction with the Department of Public Health and other departments, OEM is delivering nearly 100,000 pieces of personal protective equipment to hospitals and city departments. In fact, the precise total of PPE that has been or is being delivered is over 97,000 pieces. The first round of deliveries to 15 hospitals was a total of 3,890 N95 masks from donated supplies on March the 30th. The second round was delivered to 15 city departments for employees. Nearly 13,000 items were delivered. This included cloth masks and hand sanitizer that were either locally manufactured or commercially produced and purchased by the city. And today and tomorrow, more than 81,000 items are being delivered to 55 long-term care facilities throughout the city. This delivery is a mix of face shields, gowns, gloves, and surgical masks. This includes supplies from the Federal Strategic Stockpile, as well as donations. I thank OEM for making this a reality. And I thank city employees from other departments, including the Bridge Maintenance Division of Streets Department, CLIP, and the Fire Department, and Commissioner Teal, who have been making these deliveries from the OEM warehouse. To continue to communicate with hard-to-reach populations across the city about COVID-19, this week, Philly Counts launched the COVID-19 Community Response Captain Program. This program follows a similar structure to the Census Champion program that was launched in September of 2019. Through this organizing strategy, Philadelphia Counts has successfully trained more than 8,000 people who were able to return to their communities as trusted source of information and support. Community partners act as trusted messengers to communicate important information about the COVID-19 outbreak to their own communities. The relationships that Philly Counts has will ensure that communities are well informed about the spread of COVID-19 in Philadelphia, how they can stay safe, and what resources are available to them. Daily virtual training for this team includes updated COVID-19 information and steps for community action in English, Spanish, French, and Chinese. Community members can sign in at phila.gov/census. That's phila.gov/sentence. Before I turn it over to Dr. Farley, I just want to encourage all of us to use our common sense and use our unselfishness to stay out of each other's way, wear a mask or some face covering, and thank all the people of our hospital staffs, our police and fire, our streets department folks, everyone who's working on this is doing a yo person's job in helping to resolve this issue. So let's stay strong and we'll get through this together. Dr. Farley.
All right, good afternoon. So we are seeing continued slowing of the growth of cases of the coronavirus infection in the city. And our healthcare system is seeing many patients, but they're able to handle it. So let me give you more details. Today, we can report 494 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 5,271 cases since the beginning of the epidemic. That 494 new cases is similar to the 505 new cases that I reported yesterday. So it's good that it's in the same general range. So the good news is the growth is slowing, but we absolutely cannot assume that will continue that way. The virus may find new populations here in the city, and we may continue to see rises and falls before we ultimately see a sustained fall. We are continuing to see clusters in congregate settings, such as nursing homes and behavioral health facilities. In the city's jail, we have currently 61 inmates that are positive. Now that's one new positive since yesterday, but then other people who got infected and ill earlier have recovered, and so they've been now opened up and no longer considered positive. I want to talk a little bit about nursing homes and what we're doing in nursing homes, because those areas clearly are the worst aspect of this epidemic. We are working with nursing homes in a variety of ways to try to prevent introduction of the infection into the facility, and if it gets in the facility, to try to prevent it from spreading to residents that are in there. So we do widespread testing to quickly identify cases. We are on site with experts when we have cases that are found. And when we do that, we try to separate the residents who have an infection from those who don't have an infection. And we end group activities so they can't mix with each other. We are recommending that the nursing homes provide masks for all staff, and that all staff wear masks at all times. And we're distributing those masks to nursing homes so that they have sufficient supplies to do that. We have told the nursing homes they have to have a strict no visitor policy. And they are also putting now restrictions on residents so the residents don't leave the facility unnecessarily, interact with people, get the infection, and bring it back in. So all that's the stuff that we're doing to try to prevent spread in nursing homes. It hasn't all worked all the time. And clearly, we are still seeing clusters, but we're doing everything we can. I can report, sadly, we have 26 new deaths to report for coronavirus infection since yesterday, bringing us to a total of 104. Of that, 44 were in nursing home residents, and 66 were over the age of 70. Now, we've seen some stability in the number of new cases each day, but we're continuing to see a rise in the number of deaths. We expect that that's going to happen because the death curve is going to lag behind the curve of new infections. We do have some information on race on those people who have died. Of the 104, 25 or 24% were white, 39 or 38% were African American, 3 were other race, and 37, we have no information on race. So this does suggest that there's a higher rates of mortality of this infection in African Americans than the general population. We don't have information, unfortunately, on other races and other ethnicities. But it does worry us that, like many other health problems, this problem is affecting people who have disadvantages even more. So there were a number of questions yesterday about African Americans and what we're doing to address them. I thought I'd talk a little bit about what we're trying to do to at least understand the problem better and to try to prevent a further spread. First, we're trying to get more complete data. We may have to do special surveys to capture that data because we're not getting it on our regular laboratory report forms. We did do a survey that asked people about the degree to which they're practicing social distancing. And it's just by what people are telling us. So it maybe it's subjective, but there's useful information there. And African Americans were more likely than whites to report that they are staying at home, at 39% versus 35%. But when we asked how many people they were around, how many social contacts there were, and how that compared to what they did before the epidemic, African Americans were less likely to report a reduction in social contacts, or a reduction of fewer social contacts. So it was a 54% reduction in African Americans versus 67% in whites. So to me, we all need to do a better job of the social distancing so we can spread the infection less. Particularly, we need to get the message out to African Americans. How are we doing that? Well, we've taken out ads in community newspapers. We've held Zoom town halls with the Mayor's Office of Black Male Engagement. And then Reverend Naomi Leapart is starting a phone tree call down with religious congregations to get the message out through churches. We're providing information materials to council members and to block captains. We put inserts into people's water bills with the social distancing measures. And then even our census takers, when they're doing outreach, have been trained for outreach on COVID topics. So we're doing everything we can to try to get the message out of how important it is for people to keep a distance from each other so they don't spread the virus. Now on testing, our testing availability is similar to what it was before. For details, just go to our website, phila.gov/COVID, and go to FAQ, and you get the links and phone numbers for all the different sites where it's available. The Citizens Bank Park today site, we were told that we may have high winds and thunderstorms. At the moment, the weather looks pretty good. It may be open or may be closed depending on what the weather does. Our Center City site is open 7 days a week. You can call this number if you're interested and feel you're eligible, 267-491-5870. Now, how are our hospitals doing? Well, they're continuing to see an increase in cases, but they're able to manage it. There are 630 people with coronavirus infection in city hospitals, and 1,123 in hospitals in the Southeast Pennsylvania region. Those numbers are going up, but there are many available beds, there are many intensive care unit beds, and there are many available ventilators. So the hospitals are busy, but they can manage this. So despite the better news, just to talk to people in general, it's important for me to emphasize again how serious we need to be about staying safe, especially now when the news is a little bit better. I'm worried that people may be trying to back off on what they're doing. I thought I'd give it a message specifically to teens and younger adults, because you may think because you're not likely to have a serious infection, you can ignore this advice. But just think about this. If you get near others and you acquire this infection or you spread the infection, you're risking your grandparents or your parents or a friend or sibling who has a medical condition or the grandparents or parents of your friends. And if those people who are more vulnerable get the infection and they get a serious infection and die, you can't bring them back. And you don't want that on your conscience. So that's why it's important that everyone heed this warning. Even if you think that you're not ever going to get a serious infection, everybody needs to follow the rule to protect the loved ones around them. So stay home. If you absolutely have to go out, keep your distance from people, 6 feet. And when you're around people, wear a mask. So for more information, our website again, www.phila.gov/COVID. And if you have questions, 1-800-722-7112. Thanks.
Thank you, Dr. Farley. And now Armando will provide a Spanish language translation of those comments.
Mensaje del alcalde Jim Kenney para el jueves 9 de abril del año 2020. Buenas tardes. El Dr. Farley nos dará su actualización, nos acaba de dar la actualización en inglés, pero me ha informado que hoy hemos alcanzado un hito muy triste. Más de 5,000 residentes de la ciudad de Filadelfia han sido diagnosticados con el COVID-19. Esto ocurre semanas después de que nuestro primer caso haya sido confirmado y demuestra la velocidad con la que se puede propagar este virus. Sé que el Dr. Farley ha comentado que la tasa de crecimiento de los casos ha disminuido, pero todavía estamos en un periodo en el cual los números van a seguir aumentando. Ahora nos corresponde agradecer a nuestra Oficina de Manejo de Emergencias. Ellos, trabajando en conjunto con el Departamento de Salud Pública y con otros departamentos, han repartido casi 100,000 partes de protección personal a los hospitales y departamentos de la ciudad. De hecho, el total de equipos de protección personal que se ha entregado supera las 970,000 partes, 97,000 partes. En la primera ronda se entregaron 3,890 máscaras N95 a 15 hospitales. Se entregaron casi 13,000 artículos para trabajadores en una segunda ronda a 15 departamentos de la ciudad. Estos artículos incluyen máscaras de tela, desinfectante para manos que fueron fabricados localmente o producidos comercialmente y que compró la ciudad. Hoy y mañana se entregarán más de 81,000 artículos en 55 centros hospitalarios y centros de cuidado médico a largo plazo, protectores faciales, batas, guantes y máscaras quirúrgicas. Estos artículos son suministros proporcionados por la Reserva Nacional Estratégica, Federal Strategic National Reserve, así como de donaciones privadas. Queremos darle nuestro agradecimiento a la OEM y a los trabajadores de la ciudad, incluida la División de Mantenimiento de Calles, CLIP, y el Departamento de Bomberos, que han estado haciendo estas entregas desde el almacén OEM. Para continuar comunicándonos con todas nuestras comunidades sobre esta crisis de salud, esta semana Philly Counts lanzó el programa Capitán de Respuesta Comunitaria COVID-19. Este programa observa una estructura similar al programa Campeón del Censo que se anunció en septiembre del 2019. A través de esta estrategia de organización, Philly Counts ha capacitado con éxito a más de 8,000 personas que son considerados en sus comunidades como una fuente confiable de información y apoyo. Los socios comunitarios actúan como mensajeros confiables para comunicar información importante sobre el brote del COVID-19 a sus comunidades. Las relaciones que Philly Counts ha establecido asegurarán que las comunidades estén bien informadas sobre la propagación del COVID-19 en Filadelfia, cómo pueden mantenerse seguras y qué recursos están disponibles para ellos. La capacitación virtual diaria incluye información actualizada sobre el COVID-19 y las estrategias para mantener informados a los miembros de la comunidad en inglés, español, francés y chino. Los miembros de la comunidad pueden registrarse en el website fila.gov/census. Muchas gracias y recuerde permanecer en casa. Y esta es la actualización en materia de salud al 9 de abril del 2020. Hay una disminución muy pequeña en el crecimiento de los casos en la ciudad. Nuestro sistema de atención médica está manejando la situación adecuadamente. Tenemos que tomar en cuenta que el virus puede encontrar, sin embargo, nuevas poblaciones. Y antes de que veamos una caída sostenida en el número de contagios diario, pudiéramos observar fluctuaciones súbitas en estos números. Desde ayer, se han confirmado 494 nuevos casos de coronavirus en Filadelfia y actualmente tenemos un total de 5.271 casos en la ciudad. Quisiera describir brevemente las acciones que estamos tomando en los hogares de ancianos. Estamos aplicando pruebas generalizadas para identificar rápidamente los casos. Tenemos visitas de expertos médicos a los lugares donde se han encontrado casos para ofrecerles ayuda. Hemos determinado una suspensión temporal de las actividades grupales. Todo el personal debe usar mascarillas y se ha suspendido las visitas hasta nuevo aviso. Hay también restricciones en la movilidad de los residentes para que no vayan, interactúen o traigan la infección de vuelta a los centros. Y reportamos 26 nuevos fallecimientos en Filadelfia, para un total de 104 personas que han muerto por el COVID-19. 44 de estas muertes se han producido en hogares de ancianos. 66 muertes, o el 63% de ellas, se han producido en personas mayores de 70 años. Información en cuanto a la raza de las personas fallecidas muestra que 39 han sido afroamericanos, es decir, un 38%, 25 blancos, un 24%, 37 personas de raza desconocida y 3 que se han registrado como de otra raza. De acuerdo a la información obtenida, se ha observado un mayor número de casos en la población afroamericana. Hay que recordar que este virus no discrimina por raza o por género. Sin embargo, la ciudad está comprometida a que el mensaje de prevención sobre el COVID-19 les llegue a todos. Estas son algunas de las estrategias que estamos empleando para que el mensaje les llegue a las comunidades afroamericanas. Tenemos publicidad en periódicos comunitarios, estamos organizando reuniones comunitarias de forma virtual, digitales, y estamos proporcionando material informativo a los concejales y a los capitanes de cuadra. También estamos incluyendo mensajes informativos en los servicios de recibo de agua. Vamos a entrenar a los miembros de la comunidad a través del programa de respuesta comunitaria COVID-19 liderado por Philly Counts. En Filadelfia hay más de 20 centros de prueba. Por favor, consulte el website o sitio web fila.gov/COVID-19 con la pestaña FAQ para ubicar el más cercano a su hogar. Respecto al centro de pruebas en el Citizens Bank Park, las pruebas en este centro van a finalizar el día viernes 10 de abril a las 6 de la tarde y hoy estará cerrado por más tiempo. El centro de pruebas de la ciudad en Center City, sin embargo, continuará atendiendo a personas mayores de 50 años y a trabajadores sanitarios que presenten síntomas del COVID-19. Si cumple usted con estas condiciones, llame al 267-491-5870 para hacer una cita. Recuerde que debe ser referido por su médico primario o médico de cabecera. Y a pesar de que hubo hoy una disminución en los casos que se han reportado, tenemos que cumplir con la medida de permanecer en casa para poder estar seguros. El virus sigue circulando en nuestro ambiente. Si nos comportamos como antes y no respetamos la orden de permanecer en casa, el virus se propagará rápidamente. Hay un mensaje en especial para las personas más jóvenes. Puedes pensar que esto no es serio y que no te afectará, pero si te enfermas, puedes propagar la infección afectando a tus padres, a tus abuelos o a personas en tu familia con una condición médica. Si ellos se enferman y mueren, no podrás tenerlos de vuelta, los perderás por siempre. Y tú no quieres cargar con ese peso en tu conciencia. Por ello, es muy importante cumplir con esta advertencia. permanece en casa. Si usted debe salir a trabajar, le recomendamos mantener la distancia social de 6 pies, lavarse las manos y utilizar máscaras de tela en lugares públicos donde las medidas de distanciamiento social son difíciles de mantener, especialmente en áreas de transmisión comunitaria significativa como supermercados o farmacias. Le invitamos a consultar el sitio web para mayor información, www.fila.gov/COVID. Recuerde usted que puede llamar al 311 si tiene preguntas sobre el COVID-19. Hay servicio de traducción disponible en 100 idiomas. Y si tiene preguntas de carácter médico, puede llamar a las 24 horas del día, los 7 días por semana, al 1-800-722-7112. Y esta llamada es gratuita. Gracias.
All right, thanks. So now we're going to move to the Q&A portion for members of the media. I'd like to ask our speakers, to join us again with audio and video. Remember, of course, that we have a limited time for these briefings, so only one representative from each media outlet is permitted. At least for the first round, reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. For those who are logged in today, please use the raise your hand feature. It can be found under your participants list, and we ask you to join with by video as well, if possible, when you are called on. First, we'll start with Jeff Cole of Fox 29.
Yeah, hello. For Dr. Farley. Dr. Farley, I know you've been asked about this quite a lot, but I wanted to revisit it if I could. It's been about 24 hours since one of the federal health officials indicated that this region was a hot spot. They were concerned about it. They were looking at it. Have you had any opportunity to speak with the federal government, interpret what it is they think they're saying? And do you think that, in fact, they're just wrong?
Well, I did get information by email of what data made them concerned about this. And they're looking at the percent of tests that are positive in different cities around the country and looked at Philadelphia versus other cities. And the percent of tests that are positive in Philadelphia has been rising, and it is high. There's no question about that. However, it sort of followed the same curve as the total case count. It was rising, and it seems to have plateaued in the past few days. There's no question Philadelphia is hit hard like other cities in the Northeast, New York City being the worst. I am hopeful that we are seeing signs that the curve is flattening. I can't say for sure that is happening. I'm hopeful at this point. We're glad for the attention because we need all the resources we can. And we'll be happy to work with the federal government to try to reduce infections as much as possible.
Are you concerned that they raised an unfair fear about the region, considering that your message was somewhat different than what we heard yesterday?
No, I think people need to be concerned about this. And I think it's absolutely fine for them to call out Philadelphia as a city that's hit hard. We have been hit hard as well as other big cities in the country. And if that is what it takes to drive home the message, how important it is for people to keep their distance from people, I think that's fine.
I've last one for you and I'll be out. I heard you say on KYW radio this morning that you had gotten, quote, a bunch of those antibody blood tests and that you were going to put them in your lab to sort of begin to look at them a little bit. Some to put those on the street immediately. Chester County has. Why not put them out there quickly and see if they can work for you? And secondly, if you'd speak a little bit about your loss of testing capacity when Citizens Bank closes at the end of the day tomorrow.
Yeah, to answer the second part first, the Citizens Bank Park ended up providing 7% of the testing for Philadelphia residents amongst all the different sites here. So it was a relatively small, or is a relatively small contributor to our total testing. And when that site closes, we can redistribute the resources that they're using, including the test kits, to the other sites. And so we think we can handle that closure pretty well and may actually get more tests for the same amount of resources. As far as the rapid tests, we are very interested in making rapid tests more available. We've gotten about 100 tests that were given to us as sort of a one-time donation, my understanding is, from the company. The first thing we need to do is in our laboratory, figure out how accurate those tests are so we know how to interpret the results. I'm hoping we'll have that answer by early next week. If we have good answers to that, and if we get more of them, we will deploy them as far as we can. I'm very concerned that there'll be a limited number of these that we can deploy, and we need thousands of these tests.
All right, thank you, Jeff. Next up, Matt Petrillo of CBS 3.
Hi, thanks again for your time today. Just following off what Jeff said, the White House, the vice president said that they were actually referring to Greater Philadelphia, meaning Wilmington and Camden, as the emerging hotspots. So I think this would be best for the mayor. Is that a fair comparison to say Philadelphia is an emerging hotspot when including these other places, including the suburbs, or do you think politics might be at play here?
Well, no, I think that when people from around Philadelphia are asked by out-of-towners where they're from, they say they're from Philadelphia. I don't think that's strange. I believe that, as Doctor said, that the attention could be good. Maybe rapid testing will come faster and at a higher number, and maybe more resources could be sent to Philadelphia. And we have agreements with counties around Philadelphia relative to hospital availability and other kinds of rationing of equipment and supplies. So I don't really think that was an overtly political statement by anybody from the CDC or from the vice president.
Okay, thank you. Regarding the fund for nonprofits, do you know how that's doing and any idea when that money might be distributed?
I believe it's being distributed now. I just saw an email yesterday that had a list of organizations that received money and how much they received. I'm sure it'll be available to you.
Okay, thank you. And just one more question for Dr. Farley. We were talking to people who have been beating the coronavirus, some saying that when they had trouble breathing, they have to kind of fight through this. Do you have any idea on what people should be doing if they are having trouble to breathe, how they can kind of go about this and stay healthy?
You're saying if they have the infection and they're having difficulty breathing?
Yeah.
If they have the infection and having difficulty breathing, they ought to get medical care. So they should call their doctor. If they can't get a doctor on the phone, go to the emergency room.
The person I talked to, she's a nurse, and she said she didn't need medical care, but that she had to kind of fight to breathe in a way to get over the virus. I was just wondering if you heard anything like this before and what people can do when they are self-isolating.
I have not heard that particular person, but I've said messages before on these briefings, and I want to be absolutely clear today. If people have this infection, they're having difficulty breathing, they need medical care because, if you have this infection, you can get very sick in a hurry. So I don't want people to say, well, I'm okay, when they're not okay. And then if they crash, they don't get to the hospital in time. So seek medical care. The emergency rooms have plenty of availability. The hospital beds are available. If people need hospitalization, they can get it.
Very good. Thank you, Matt. And next up is Pat Loeb of KYW.
I want to go to something Dr. Farley said about the prisons. You said that there was one additional case, but others had gotten better. And I just wonder how this actually would apply to any case, how you kind of define recovery. Do you have to be tested and test negative, or what does recovery actually consist of?
I'll double check with the jail, but I think that these people don't have symptoms, and I believe that they were tested again and shown to be negative. Okay,
so someone is considered recovered when they test negative.
We're not recommending testing at the end of illness for people who are living at home, but in a congregate setting like a jail, where we know that there's greater risk, and we're trying to figure out what people can be staying with what people. We don't want to put an infected person with an uninfected person. So that kind of testing may be valuable there. Again, I can't say for sure that that's what they're doing there, but and I'll check and get back to you on that. But I'm guessing that's what happens.
Okay, good. And then this is probably for the mayor. There was a tape released today from inside the prison where people were crying and pain from the illness. And I just wanted to get your response to that.
Obviously, I haven't seen the video. Would be happy to see it.
Yes.
If there are medical personnel there to attend to people's needs. And if someone needs to be hospitalized, I believe the prison protocol is that they take them to a hospital. So I don't know. It's hard to comment on something you haven't viewed.
Okay. Thank you.
All right. Thank you, Pat. And next up, Wendy Saltzman of NBC 10.
Hi, Mayor. This is Wendy Saltzman, NBC 10. I had a question about budgets. I know we're all going to be dealing with budget issues when it comes to next year. When it comes to the school district, is your expectation going to be that they're going to have to tighten their belts because they're going to be getting less money from the city?
Well, the issue is we knew coming into this year that next year the school district was going to have a significant financial problem separate from the coronavirus and separate from all the expenses that we're taking on now. So we had a school district problem to begin with. The issue is that there's been so much progress made since the last recession that we put back personnel, nurses, people in the classrooms, classroom aides, principals, other types of supply and equipment that they had to get rid of and couldn't replace. So we're back to where we kind of were and making steady progress. So we're going to have to think hard and long about shorting the school district, even though we're going to have a struggle with our revenues. We need to look at the whole picture because going forward, if our children aren't getting educated, they'll continue to live in poverty and we'll continue to have this high poverty rate. Will be exacerbated by this downturn in the economy.
So I'm sorry, can you explain that a little bit more in terms of, they talked about how the liquor tax, people aren't out drinking, or the soda tax. So is your expectation that no matter what, you're going to have to cut the budget for the school district? I don't know. We're going to try. It will be a major priority for us to keep the progress going at the school district. I know it's going to be a strain to do it. And I agree that the liquor tax is probably, nothing coming in for the liquor tax, and use and occupancy tax, which they share. So we will see the numbers relatively shortly, probably within the next 30 days or so, and we'll have a game plan, and we'll have to consult with City Council, obviously, because they have to pass a revised budget, and it's not going to be fun. There's going to be some hard choices that have to be made, and we're going to have to be adults about it. But you're saying that that's one of the last places you want to cut money from? I mean, this entire administration has been based on education and improving education, and we'd hate to pull the rug out from under our school teachers and principals and kids once we've gotten to the point where we're starting to make progress. But we'll see what happens in the end. I have no concrete information to give you at the moment.
Very good. Thank you, Wendy. Next up is Laura McChrystal of the Inquirer.
Hi. I'm wondering, yesterday it was mentioned, I think Brian mentioned that there have been instances of cases at homeless shelters in the city, and that the city was trying to work with service providers to do more, but it maybe has interrupted care. Could you provide any more details on, a number of cases or a number of shelters affected, and what the city is doing about that?
Sure. So I don't have the number of cases or even the number of shelters. We can see if we can't provide that to you later this afternoon. I think the most important thing is
Brian, I think we're having some problems hearing you. Try that again.
Sure. Is it better, Mike?
Yeah.
All right. I'll speak up louder. So Laura, I can't speak to specifically how many cases are in the shelters or how many shelters were impacted. But it is one of the reasons we were so focused on getting the Holiday Inn up and running. It took us a little bit longer than we wanted it to provide those social service and wraparound services that are important for this population. But that is in place now. We've had a number of unsheltered individuals check into the Holiday Inn. Yesterday, I know it was at 12. I'll see if we can't get you an updated number today. But that is exactly what that space is to be used for, is for isolation space to make sure our shelters are protected and our other congregate care facilities are okay.
Okay. And since you now have people at the Holiday Inn, I think you had previously said the city was looking to secure as many as 6 hotels as possible quarantine space. Have any more been secured?
We are in close negotiations. We're close to signing leases with, I believe, 5 other hotels. Our goal right now is to have 750 additional rooms, or 750 total rooms, sorry.
Okay, and those hotels would just be for quarantine space, right? Is that separate from potential surge hospital space? And do you have any updates on those negotiations?
The hotels would be used for isolation and quarantine space. And then the surge hospital space, again, the Leah Core Center is being built out, and that progress is going well. We don't have any updates on additional surge hospital space, but I have a number of options that we're continuing to track.
Great, thank you, Laura. Next, Shara Arias of Telemundo.
¿Se escucha?
Sí.
Okay. Hola Armando, hola a todos. Hi everyone. So la primera pregunta es, básicamente ya las clases se han tenido que cancelar por el resto del año. ¿Cómo planea la ciudad, el distrito escolar, manejar esta situación para que los estudiantes se puedan beneficiar y tener toda la educación disponible, ya si sea virtualmente? ¿Y qué consejos les pueden dar a los padres que van a tener a esos niños hasta el final del año en sus hogares? ¿Cuál es el plan para esto?
Given that the schools have closed for the rest of the school year and there's a need to educate the children virtually or remotely, what advice can you give parents in terms of doing this? And what is the plan ahead in view of this?
Mayor, you want to tackle that?
We're getting out. We're pushing out the Chromebooks and the academics that go along with their telecommunicating with their teachers in the schools, and that's ongoing, and that'll be put out to the end of the year. During the course, I believe, and Brian, you can correct me if I'm wrong, I believe that during the course of this time, we'll be able to mitigate some of the lead and asbestos issues because the kids won't be in school. And then what we can do, I mean, every family is different, and every family has different resources. The best thing you can do is to be in the house at home with your children, read to them, and follow the guidelines of the school district that you've received relative to the age and grade of that particular child.
Queremos decirles que estamos proporcionándoles libros y material de apoyo académico a los estudiantes y a sus padres, y que los estudiantes están manteniendo en contacto a través de telecomunicación con sus maestros de aquí al final del año escolar. También que estamos tratando de mitigar el problema permanente que teníamos con amianto, es decir, asbestos en los locales de las escuelas, y se está aprovechando este periodo para retirarlo. Cada familia es distinta, cada escuela tiene recursos distintos. Lo que les recomendamos a los padres es que estén en su casa, que les lean a sus hijos, que cumplan con el plan académico que se les ha enviado y que permanezcan en casa durante esta emergencia.
Brian, I think you wanted to add something.
I'd only add that the governor's ending of the school year creates some additional concerns from parents, and we're actively working with the school district to resolve those concerns.
Quería agregar de que el gobernador ha dictaminado el fin del año escolar y que esto está causando ciertas inquietudes para los padres de familia. Nosotros vamos a trabajar con ello para resolverlo.
Okay, thank you, Mayor and Brian. The next question, Armando, me imagino que puede ser para el doctor Farley. Él más o menos ya habló sobre esto. Básicamente, ¿cuál es la opinión de parte de la ciudad, del doctor, sobre el hecho de que Filadelfia se puede convertir en el próximo centro de contagios, de hotspot? Y si en dado caso eso sucede, ¿qué significa esto para la ciudad en cuanto a la ayuda que van a poder recibir de parte del gobierno? Para que las personas tengan una idea completa de que si eso llega a suceder, ¿qué va a pasar después?
Y Sheila, te refieres, Zaira, al gobierno federal, ¿verdad?
Sí, ¿cuál sería la ayuda que recibiría la ciudad y qué significa esto?
Bien. This is a question for Dr. Farley, primarily. I want to get his opinion and the city's view. If the doctor believes, as many means are reporting, that Philadelphia may become the next hotspot for the virus. And if that's the case, what does it mean in terms of the aid that the city may be able to receive from the federal government financially?
I don't know exactly all the data that the federal government is looking at. I think if you do look at the entire country, you'll see higher rates in Philadelphia than in other cities of the country. And so that's why we're getting their attention. We think it's good that we're getting their attention. We hope that leads to resources. Doesn't necessarily mean, though, that the case rate is going to continue to grow here. I still am cautiously optimistic based on what I've seen the last few days that we've slowed the growth of the curve. and that's the most important thing. But again, I welcome the attention of the federal government, and we welcome any help they can give us.
No creo que tengo todos los datos disponibles que tiene el gobierno federal para ver esto, pero no creo de que la tasa de contagio en Filadelfia sea más alta que en otras ciudades. Sin embargo, la atención es bienvenida porque nos puede llevar a recursos extras, pero no significa de que sea porque tenemos una crisis aquí. Yo quiero ser optimista de una forma cautelosa porque estamos logrando la reducción de la curva en la ciudad y vamos a enfrentar esto según los recursos que tengamos más adelante.
Okay, perfect. Thank you so much.
You're very welcome.
Great, thank you. And next, Denise Clay of The Sun.
Okay, just a second. I hope you see my little picture there. My first question is for the mayor. There's been talk about, the number of prisoners that are, that have the virus in the city's jails. What is the status of the efforts to get nonviolent offenders out as a means of having fewer people in the prisons to facilitate the spread of coronavirus?
The mayor, myself, does not have the authority to sign releases. They're being worked through the court with petitions that have been filed on their behalf. I don't know the status of those hearings, but they should be, I guess, ongoing or soon to start. So we're waiting for the court to make their decision on who should get out and who shouldn't.
Okay.
I can provide a little bit of an update. So the courts have actually had a number of hearings all week. I think they have 4 separate courtrooms running, and they've been able to get through dozens of cases a day. And our census population is definitely showing that decrease as we speak. I believe our census for all facilities today was right around 4,200, which is down from almost 4,800 on March 16th. So significant progress.
Okay. Dr. Farley, around the country, you have medical centers that have been trying to produce their own tests for the coronavirus as a means of kind of augmenting what they can and cannot get from the federal government in terms of testing. Have you heard from any of the universities here like Penn or Temple that have medical schools about any experimentation being done to try to start that kind of testing ourselves?
Well, let me say first, many of the medical centers in Philadelphia are running the tests in their laboratory. Those are pretty much the standard tests that are being done around the country, but they are running it in their laboratory. What is really needed is the development of rapid tests. There are rapid tests that are coming on the market from big commercial companies. I have not heard of any developed locally that are doing that, but any rapid test that is accurate is a huge advance, and we would encourage people to do that and give us as many of them as possible.
Okay, and for my final question, Sunday, as everyone knows, is Easter. And while for the most part, people are having church services online, we've read about a couple of ministers, even a couple here locally, that are kind of determined to have in-person services. I know constitutionally there's probably nothing you can do about that, but what about from a healthcare perspective? I mean, what message should people be, getting from, their, getting to their parishioners about whether or not they should, come to a service in person?
Well, we are recommending to people not to attend church services in person there. And Reverend Naomi is kind of communicating with ministers not to hold those gatherings because those could be a great risk. So this is not something which you can so much police as it is something which all of us socially need to communicate to people, say this is not in the best interest of people here. I think, you're bringing this is important. We want to get that message out as widely as possible. That's a very high risk setting to have a group of people together in any setting.
Yeah, and just to
God can hear you from home. God can hear you from home.
And just to follow on enforcement, I think we mentioned this yesterday that any a church building like any other building that holds a large gathering, the L&I can enforce a cease operations order. We certainly don't want to get to that point, but 311 is accepting complaints, and we will respond appropriately if and when we receive those complaints.
Thank you, Denise. And next up is Layla Jones of Billy Penn.
Okay, hi, thank you. I had a few questions about that survey. I wanted to know how and when it was conducted and how many people participated in that survey about social distancing. This is for Dr. Farley.
It was done last week. It was done over the internet, and I think we've had about 600 participants.
Would you be able to share those results with me?
Yeah, we can put out results.
Okay. And another question I had, how many people are signed up for those coronavirus text alerts? Do you guys know? I think last week it was about 74,000.
Yeah, I'll see if I can't get an update before this ends.
Okay, thank you.
No problem.
Are you good, Layla?
Yes, thank you.
All right. Next up is Matt Wargo of NBC News.
Hey there, guys. Matt Wargo from NBC and MSNBC here. Temple guy, former Channel 3er. First, thanks for hosting these. I know I haven't jumped in yet, but I've been following along as the city's been kind of prepping and watching this progress. First one for the group here. Just to be clear, at this point, has the federal government or task force offered any additional resources to the city in the past 24 hours in terms of aid, PPE, or supplies?
In the past 24 hours, not that I am aware of, no.
Okay. Next one for Dr. Farley. Just looking ahead at what might be to come, whether you're looking at your models, the federal government's, what is concerning you most at this point?
Well, the number of cases we're getting per day is been pretty steady for the past few days, but it's steady at a pretty high level. And we haven't seen sustained declines. And so it is quite possible it could turn up again. So that's the number that I'm following the most closely. And then I'm following closely what's happening in our city's hospitals. Right now, there's a rise in patients seen at the hospitals or staying at the hospitals every day. There's still plenty of slack, but I'm watching that closely so that if we need to go into another mode and add beds or add other facilities, we can do that.
At one point, you said that you were keeping in touch regularly with a lot of the hospital chiefs throughout the city. Has their tone changed on any of this? What have you been hearing? Are they anxious to see patients? Are they in the waiting game as well?
I last spoke to them on Monday evening, and I'll be speaking to them again tonight. And when I spoke to them on Monday, they were definitely, they were busy. They were seeing a number of patients, but it was under control. They felt that they could provide adequate care. And we'll see tonight if they're still in the same position.
Great. Thank you, Matt. Next up is Martin Pratt of Philly YBN. Martin.
Hey, yes.
You're up.
Hey, Dr. Farley, can I also get a copy of that, the survey? And good job on the radio this morning. Heard what you said to Charles Ellison. One quick question about the survey, which you brought out on your radio interview, was a different disparity between African Americans and white participants. Was there a question asked about the type of contact? You mentioned on your interview that there was a difference in the contact. Was there a question that was specific about contact at home or contact at work?
Yeah, if I remember the survey correctly, and you'll see when we get the results, we asked about household contacts and work contacts and social contacts. And then we saw how they changed before and after. This is all just based on their own estimates. So take it with a grain of salt, but it gives us some indication of what they believe, how things have changed in those three different areas.
And second follow-up question, or a different question, are you considering using other type of respiratory machines, such as like New York has started to use, I think it's called BCAP, or the machines for people with sleep apnea as respirators?
So we work to see what are all the different sort of machines that could be used if you run short of ventilators. And there are other sorts of machines that can be used that are not as good, but are still probably adequate. So far, we're not anywhere close to using all the ventilators we have, so we don't need to get there. If we did, we would have that as a fallback.
Excellent. And this is really for Brian. Brian, can I also get a copy of the numbers for those that were touched by texting? And this is anecdotal. was at the food distribution center here in West Philadelphia. Again, excellent job. Food was given out. There was enough food, and people left pretty happy.
Great. That's actually, I appreciate that. And yes, once we get, I'm hoping I get the numbers before we leave here today, and I'll either send it around through the chat or come back on and announce it.
Yes, and if we get those later, we can certainly send those out to you. Next up is Andy Metzger.
All right. So this is a question for Dr. Farley. The data that you're using and telling us about every day, does that come from the hospitals or from FEMA or some other source or all of the above?
Yeah, we get the data from any laboratory that's running a test on a Philadelphia resident. And so that could be our testing site at Citizens Bank Park. It could be testing done by our clinics. It could be testing done by any provider in the city of Philadelphia. When a lab gets it, we get that result.
And is FEMA using that same data source?
I don't believe that FEMA has the individual case reports. They may be looking at the aggregate numbers that we're reporting out just as you are.
Okay, but bottom line, are you and the feds both looking at the same data but coming to different conclusions in terms of where the city is, where you're saying you hope that it's maybe peaking right now and could drop off, and yesterday there's a pretty clear message that in the Philadelphia area they're worried about it becoming the next hotspot?
I think it's asking slightly different questions, which sound similar. One question is, how does Philadelphia compare to other cities or other areas of the United States? And the second is, what's the future look like? What's the trend? And I think looking at the data, how does Philly compare to other areas of the United States? It has higher rates, absolutely. And that's been the case for a couple of weeks now. So when they look at that, that's the conclusion they come up with. I'm looking at now, knowing that, what's our trend? And I am more optimistic about our trend, that it's been rising quite quickly, but in the last few days, it has been rising much more slowly. I can't guarantee that will continue, but if it does, that would be a good sign.
Great, thank you, Andy. Next, Mike Donofrio of the Tribune.
Just regarding the survey, I also, of course, like to get it to. Are you going to post it online? Or are you going to email it out individually?
So our press person, Mike Dunn, is going to tell me exactly how to distribute that.
Okay. I guess
we'll get it to you. We'll get it to everyone.
All right. You said, Dr. Farley, that you expect to do more surveys. When do you think you'll do more? How many? And how do you think they're going to be conducted and so on?
I don't know that I was implying that we would do more surveys like this one. We might, but I'm not promising that. I think that the question that I was trying to address was the fact that we have very limited information on race of the people who are coming down with the infection. And so we're seeing if there's some other data sources that can tell us more about whether we have differential rates of this infection by race. That I don't know that that's, well, I wouldn't necessarily call that a survey, but we're going to see if we can get that information.
Okay. All right. That's all I got. Thanks.
Great. Thank you, Mike. Next is Charlene Santiago of Univision.
Hi, yes. So mi pregunta que ya se la envié es que, por ejemplo, en diferentes vecindarios en Filadelfia, aquellos con mayores ingresos se están haciendo más pruebas en comparación a aquellos vecindarios donde los ingresos son mucho menores. ¿Qué está haciendo la ciudad al respecto? Si es que están haciendo algo para garantizar que todo el mundo tenga acceso a estas pruebas.
The numbers indicate that there are more people from higher income neighborhoods being tested compared to neighborhoods where people are unemployed or uninsured. There is less testing there. What is the city doing, if anything at all, to ensure that lower income people are tested? And would you consider opening more testing centers?
We think we would like to do more testing everywhere and have testing more available for everyone. The limitations on the number of test supplies and the laboratory capacity and turnaround have really limited the value of testing overall. However, having said that, we are taking supplies and providing them to sites in North Philadelphia and West Philadelphia, which are the two poorest areas of the city, so that we have adequate availability for testing in those areas.
Pienso que nos gustaría hacer más pruebas para todos y en todo lugar. Nosotros hemos estado limitados por los suministros, la capacidad de los locales y por el tiempo para recibir los resultados, pero hemos llevado material a los lugares al norte y al oeste de Filadelfia que tienen gente de población de menores recursos para poder facilitar estas pruebas.
Perfecto. Y la segunda pregunta era si por favor pudieran caminarnos nuevamente por el proceso de cómo acudir a estas pruebas, teniendo en mente a aquellas personas que quizás no cuentan con un seguro médico o con un estatus legal en el país.
And again, in connection with testing, can you run by us again, what is the process for getting tested for those that don't have health insurance, may not have legal status in the country, or those that may not have a primary physician?
Testing is free for everyone. There's no cost. If anybody wants to get a test, they can go onto their website under the FAQ, and it tells you all the different sites where it can be done. And there are links to those sites or phone numbers where you can call. There's no checking for immigration status on that. So anybody who meets the clinical criteria should be able to get a test. Now, we're not recommending people get a test if they have no symptoms or if they're under the age of 50, if they're not a healthcare worker. Testing are for people who are healthcare workers or over 50 who have symptoms.
Nosotros queremos recalcar de que las pruebas no tienen un costo, son gratuitas, y que las personas que están interesadas en obtener una pueden ir al sitio web y ver las disposiciones bajo la pestaña FAQ, que indica los sitios donde se están dando las pruebas, y hay enlaces para llegar a esos sitios. Incluyen también sus números de teléfono, porque hay que hacer una previa, y no pide información sobre el estatus migratorio de una persona sobre pruebas, pero tiene que satisfacer el criterio clínico para tomar la prueba. Ser una persona que esté mostrando síntomas, que sea mayor de 50 años o sea un trabajador sanitario.
Perfecto, entonces eso hay donde no se necesita específicamente el referral del doctor siempre y cuando tenga estos requisitos.
Does this mean there are centers where you don't need a primary doctor referral as long as you meet the other clinics?
Yes, the phone number that I read earlier, people can call directly. Someone who will screen them based on their symptoms, and if they have their symptoms, to our site and get tested.
Sí, yo di un número anteriormente al cual puede llamar la gente para hablar con una persona que les va a hacer unas preguntas iniciales para ver si son elegibles para proceder a las pruebas.
Thank you, Charlene. And Brian Abernathy determined that 75,100 folks have signed up for those text alerts. So I know we had a question earlier. Thanks, Brian. Next up, Jake Bloomgard of WHYY.
Hey there. So I am working on a kind of pretty specific story about unemployed construction workers who don't have their documents and aren't able to kind of access unemployment insurance, things like that. So just kind of wondering what the city is doing kind of for workers who are in that very specific and dire circumstance, and kind of like how outreach is working for them.
Well, from the city standpoint, we're raising money for the COVID fund, which is supplying resources to organizations that traditionally deal with and serve that community. There's nothing the city can do from an unemployment compensation standpoint. That's a state controls the rules and regulations for unemployment compensation. So we'll continue to try to serve through these nonprofits. And again, offer whatever services the city could offer, with the exception of unemployment compensation.
I just want to add, Jake, that's exactly why we've stood up our food distribution sites, which are available to anyone without documentation or without ID, to make sure that our entire city at least has access to food.
Okay. Thank you, guys.
All right, you're good, Jake. Thank you. Next up is WPVI. Please identify who is asking that.
Hi, this is Maggie Kent from Channel 6. I have a question about city employees. Have any city employees been laid off or furloughed?
Not at this point.
Okay, and so nobody, even non-essential people, everybody's receiving.
I think I heard the bulk of your question, Maggie, but then you trailed off. At this point, we have not issued any furloughs or layoff notices. But as the mayor said, we are in the process of going through our budget and working through some very painful scenarios as we go into FY21.
Okay. Part of that question was even the non-essential employees are currently receiving their full paycheck. And also, to follow up with that, how will those decisions be made about layoffs? Will it be non-essentials first?
So yes, even non-essential employees are receiving their paychecks. At some point, we will be reopening the city and we're going to need employees to come to work. And as far as how decisions are going to be made, I think we're in that process now. You have the entire mayor's cabinet working to understand the budget impacts, the ramifications, and the service reductions that may come with our very disconcerting financial position, and would expect to see those decisions as we move into a May 1st resubmission of the budget.
And Brian, are you seeing effects of unemployment here in the city with companies or restaurants closing good, also losing some tax revenue as well?
I lost you about halfway through that question.
I was muted. Are you seeing the effects of mass unemployment in the city, including restaurants closing, companies?
Maggie, you're going to have to get closer to the microphone. If you could try one more time, please. Yeah, we can't. I'm sorry, Maggie, we're not able to hear you, but I believe your question was whether we are seeing the impact of job losses so far in the city.
Well, in many areas of revenue collection, certainly it's obvious that people aren't working, they're not paying wage tax. If people aren't going out and drinking and eating, they're not paying liquor tax and U&O tax, people are closed. So we don't know what those numbers are yet. We will know relatively shortly, or at least be able to project, but that's not going to be pretty under any circumstances.
Very good. Thank you, everyone. Unfortunately, we're out of time, but we will again resume these briefings tomorrow at 1 p.m. Thank you.